Hello, everyone. I am Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is February 18th, and this is our weekly COVID-19 update. We got two other folks on here with me today. Would you all like to introduce yourselves really quickly? Adrienne?
I'm Adrienne Showalter Matlock, the COVID-19 project manager for the UG Public Health Department.
And I'm Jason Glenn. I am an associate professor at the University of Kansas Medical Center, and I work with the Unified Government Health Department in vaccine prioritization.
All right, great. Thanks for being on here today. And Dr. Glenn, appreciate you joining us. You're new to our weekly updates. And Adrienne, thanks for coming back on here. So today, you mentioned vaccine prioritization. We're going to talk about who's eligible as of right now to get vaccinated in Wyandotte County, and then how we've prioritized that vaccine rollout here as we're in the midst of phase 2 and as our vaccine supply is still limited. So Adrienne, do you want to talk first about who's eligible right now?
Sure. So our phase 1 eligibility folks are still eligible. So healthcare associated workers who have direct patient contact in a hospital or clinical setting are still eligible. And in phase 2, according to the KDHE Kansas state guidelines, we are now currently scheduling folks that are in public safety, education, K through 12, childcare, transportation, and as well as food service, grocery, and food processing. So we have also just this week been able to start expanding our age-based scheduling to 65 and up. So we had previously been scheduling people for 85 and up, and now we've been able to extend it due to the vaccine availability to 65 and up. We are prioritizing within that 65 and up category folks that live in zip codes that we've identified using our COVID vulnerability index. And we'll talk more about that in a moment.
All right. And I just want to clarify, this is people who are 65 and older and live in Wyandotte County?
Yes. So if you live in Wyandotte County, you're a resident of Wyandotte County.
All right. So you mentioned the COVID-19 vulnerability index and using that to prioritize based on people who live in specific zip codes. Dr. Glenn, do you want to talk more about what that index is and why we developed that?
Sure. What we wanted to do was prioritize people who have the highest vulnerability. We can think of vulnerability in roughly 3 ways. There is vulnerability to exposure to the virus, and we know that folks in certain industries, like healthcare, like public transportation, like food production, and like education, have a higher vulnerability to exposure to the virus. We can also think of vulnerability as those who are most likely to develop a severe form of COVID-19 if they are exposed to the virus. And that includes people who are more likely to need hospitalization, ventilation, and who are at the highest risk of dying. Then we can also think of people who have a vulnerability in terms of they work in industries who they may spread it to other people who are extremely vulnerable. And so those are like your home health aides and health aides who work in long-term care facilities and nursing homes. What we try to do with our vulnerability index is consider all 3 forms of those vulnerabilities and issue a score per se in order to maximize the people who have the most vulnerabilities. We also know from national data that people who are 65 and older and have comorbid health conditions are the ones who are most likely to develop the most severe forms of the disease. So we've come up with the vulnerability index to try to target those persons, also doing so within state guidelines about who to target as well. The state guidelines focus more on vulnerable critical infrastructure industries, and we've tried to augment that by focusing a little more on those who have the highest vulnerability to mortality. We have used, since the counties don't have personal health information to figure out who has comorbid health conditions, we have used things like income and whether or not persons have health insurance as proxy variables for general overall health. And those aren't perfect proxy variables, but we know that they're very good proxy variables for knowing who are the most unhealthy folks among us. And that's how we came up with the zip codes that we are targeting right now, and the order of the zip codes that we will target.
Right. And as I understand it, you mentioned things like health insurance. I know that the proportion of folks who do not have health insurance was one of the things that was used for determining the zip codes, and also how hard hit they've been by COVID-19 cases so far. It's sort of the combination of those factors to find what areas in Wyandotte County are at the greatest risk and have been the hardest hit. Is that an accurate picture of that?
Exactly. Exactly. So we looked at that as an indicator. We had map overlays for where we had the most coronavirus cases in the county, as well as where we have the highest percentage of people who are uninsured. And we combined those together to figure out the areas where we know that there's going to be that high vulnerability, and then select for age. Age is one of the things we do have data on. Is easily verifiable, but we needed a proxy variable for thinking about people who have health conditions that put them the greatest at risk.
So let me walk through and make sure I understand correctly how we use this when we're rolling this out. So like right now, for instance, residents in Wyandotte County who are 65 and older are eligible. But we have those different sort of tiers of zip codes that ranked by the level of risk that we had mentioned. So those highest risk zip codes would be the ones who'd be prioritized first for scheduling as we have available vaccine supply. And then within the 65 and older, we move through those. After we get through the folks in the highest risk, we move to the next category, and the next category within that age group and within phase 2. And then in later phases of vaccine rollout, we may use similar prioritization, but it's after we go through the 65 plus who are in all those different zip codes in that order. Is that capture the process?
Yeah, the only thing I would add is, we need for people to complete the vaccine interest form, because this is how the process works. You complete the vaccine interest form, and we receive your name, your contact information, and your eligibility information. Then, according to our vaccine supply, we reach out to schedule people for their vaccination appointment. So in our age-based scheduling, we are prioritizing people who are 85 and up. And then when we are looking at those that are between 65 and 84, we call the folks, we reach out for that scheduling to folks in these 3 zip codes, and then we move into folks in the other 2 tiers of zip codes. Now, we anticipate that more people will complete the vaccine interest form, because we know that not everyone has completed it yet. So then we go back and we see, who else has completed the form, who's 85 and up, who else has completed the form that's in these 3 priority zip codes, and then the other 2 tiers. One of the things that this measure of being uninsured, rates of people who are uninsured, it also overlaps a lot with people that have barriers to healthcare access. And we've seen that already, even with our vaccine interest form, that there are a lot higher rates of people completing the form in areas where there's people that have more access to insurance. And so the numbers of people in these priority zip codes are lower. And that's part of that, is just part and parcel of this prioritization COVID vulnerability index.
All right. Well, Adrienne, you mentioned that people need to fill out our form. How can people do that?
You can go to our COVID hub website or go to ughealth.info/vaccine. That is a way that you can complete the form online in English or in Spanish. And you can also, if you do not have access to a computer, you can call 311, press 1 to be connected to our COVID hotline, and somebody can help you to complete the form. Really, though, we also ask that everybody not only complete the form, but that they help a friend, a neighbor, and a family member to complete the form. So if you know somebody who has technology access barriers, somebody who has language barriers to completing the form in English or Spanish, we really appreciate your help with getting the rest of the community signed up so that when they're eligible to be scheduled, we can contact them.
All right. Well, thank you so much for our conversation today. It's really great to get more of that background on how this prioritization works and remind folks of who's eligible right now, especially making sure your loved ones who are 65 and older get signed up if they haven't already. All right. Thank you so much.
Thank you, Janelle.